Hello. So I'm Leela Shanti. I'm Programs and Development Officer at Action Through Enterprise. Thank you very much for having me here this evening and to pitch on behalf of AIT. So AIT takes a long-term view to reducing poverty in Laura, in the upper west of Ghana. We do that through education, small business development and improving the lives of disabled children. What makes AIT unique is that we're the only organisation delivering a holistic package of programmes for rural communities in this incredibly neglected part of Ghana. Over the past 6 years we've really grown, and last year with the support of Tiffin, who supported our school feeding programme, we were able to launch our Gombole hub down in the south. We now have 4 hubs and we feed over 1,000 school children each school day. We've supported over 80 small businesses and improved the lives of 160 disabled children and their families. The problem that we're seeking to address is one of capacity, particularly in order to do much more for disabled children and their families in Laura. In the context of rural poverty in Ghana, disabled children are the least likely to attend school or go to the local clinic, and they face incredible discrimination from frontline professionals, their extended families and communities. For example, even my grandmother asked me to throw the child away. I was asked not to send him to hospital any time that he was sick so that he would die early. Without access to information or support, families with disabled children are driven into greater poverty, deep isolation, with huge implications for their well-being. AIT's Special Needs Awareness Programme, SNAP, works to overcome isolation, enable access to healthcare and education, and fight discrimination in the community. Currently, AIT works as effectively as we can with extremely limited infrastructure and resources. In 2015, we sourced a 3x3 metre shipping container as an office space with no electricity and room for just one desk inside. It is basically a human oven when it gets very hot. We now have 5 full-time staff here with our Chief Executive, Sarah. However, our capacity is severely hampered by poor facilities. For example, our monthly SNAP meetings are at capacity for the hired space that we use, and we have no room for the development of much needed resources. Our solution to these challenges is to embark on a capital project to build an inclusion centre and office space. The aim will be to create an accessible space for a play scheme and drop-in services for disabled children, flexible and fit-for-purpose workshop and meeting space, and professionalised office for staff. There will be huge benefits to developing such a space, and the funding to do this will affect transformation for us in the following 4 ways. First and foremost, it will model inclusion and increase the visibility of disabled children and their families. Secondly, staff and volunteers will have access to appropriate workspace, securely stored IT equipment, and that's going to increase their capacity and their reporting. Thirdly, we know from opening our very small office space that it will transform how the community engage with us. It will increase contact time, enable us to better understand and drive casework, understand their needs and deepen our impacts. Finally, it will give us the base that we need in order to roll out our programmes, our replicable hub model, across the district and wider region. So why now? We've been leased the land by the local government on a 50-year renewable lease. We've had to begin groundworks in order to secure our use of that land and are committed to seeing this project through. This year we've really focused on our SNAP programme, and in March we hired Camille Isahaku on the right as our SNAP programme leader, and that's to drive the recommendations of the SNAP evaluation that I carried out in 2016. We've seen some great results from his casework, but we know that the drop-in centre and drop-in services will really drive that casework to increase our reach. The Inclusion Centre and office space will be transformational for us in terms of our staff capacity, and will measure the impacts on our programme delivery. We expect to see an increase in the number of disabled children and families accessing monthly support, enabled to access healthcare and education, and we'll measure the number using our newly developed play scheme and drop-in services, and those newly reached throughout the year to overcome isolation. But the real impacts will be captured in the individual stories. This is Paulina. She's 6 years old. We believe she's got undiagnosed cerebral palsy and she can't walk. Her mother heard about SNAP and started coming to meetings on a regular basis and engaging with other mothers of disabled children. This enabled her to start to see disability as a medical issue, rather than one which might be spiritual or caused by witchcraft. In July, she asked to meet with 8 privately, and she explained how desperately Paulina wanted to go to school. And she explained all of the barriers that there were in place to prevent that, including the fact that Paulina's father didn't see the value in Paulina getting an education. 8 visited the family home, the local school, and started a process of negotiation and planning. We fixed their bicycle, provided a wheelchair and school uniform, and I'm very happy to say that Paulina started school in September. This is the difference that our programme makes, and what we want to do much more of. Tonight I'm asking for £20,000 towards the build of the Inclusion Centre and office space. This would fund just over half of the build, which we expect to be £37,000 in total. Any additional funds raised tonight would be going towards completing the building, maintenance and resources for the play scheme. Without accessible space or suitable organisations to partner with in Laura, the build is the only compelling option for us to increase our capacity and model inclusion for most persistently marginalised within the community. Thank you very much for listening to me and for any support you might provide.